We'll quickly get to address another measure which is used for trying to be aware of the amount of glucose that is in your body, and this is what is known as the blood glucose self monitoring. So this one is like they're actually trying to, like, they give you some one or two simple instruments that you can use to be able to maybe just put on your hand, and it's able to tell you the amount of glucose that is in your body. Though they might not really be so accurate like the lab test, but at least they are close to giving you the right result. So glucose self monitoring, first of all, you should know that it's a process where people with diabetes, they can regularly check their blood sugar using a glucometer. So it could be a healthcare provider that is doing it for you, or if the patient is learned, you can actually teach the patient how to actually do it. So of course it helps to now guide the level at which their sugar levels in the body is going. You understand? So it's a method where patients measure their own glucose using a handheld meter and test strips. Do you understand? Very simple methods, and it just display on the screen the amount of glucose you have. So how it works: a small drop of blood, usually a finger prick, is placed on the strip, and the meter displays the glucose levels. So purpose: it provides real-time feedback to help patients, and also healthcare providers. I could actually tell my patient that before I see you is in 2 weeks time, but before this 2 weeks time, I need you to be giving me every after 2 days, always be writing how your glucose levels were. Of course, maybe I'll give you the patient medications. I've told them some foods that they should stop eating and all of that, so it actually helps. So who should monitor? Type 1 diabetes frequently, 4 times a day. Type 2 diabetes may monitor less, but can still be useful. So benefits of this is actually improves glycemic control, helps you to advise the patient better, and actually lowers the glucose levels. It prevents hypoglycemia, dictates low glucose levels early, allows quick treatment, empowers patients, so it will encourage active or participation on diabetes management. It also supports clinical decisions. So data that is collected there can be used to now adjust the type of drugs that is being given to the patients, right? So that the treatment and everything is very nice.